This is the second video for the endocrine system, and we're going to continue by talking about the pancreas. So the pancreas, as with the adrenal gland, is composed of two types of tissue. One is an exocrine portion, which will secrete digestive enzymes into the small intestine by way of ducts. And the second is the pancreatic islets, which are the endocrine portion of the gland, and they're going to release their product into the bloodstream. There are three types of islet cells in the pancreas. The first is alpha cells, which produce glucagon. Secondly, beta cells, which produce insulin. And these both act to regulate blood glucose levels. And the third type is delta cells, which produce somatostatin. And what that's going to do is to regulate the other two types of cells and the hormones that they release. So insulin gets released after eating, and as we've mentioned in the previous video, it will stimulate the uptake of glucose by cells, but more than anything else, muscle cells, liver cells, and adipose cells. It will decrease blood glucose because it is stimulating these cells to take glucose out of the bloodstream. Glucagon, on the other hand, will get released before eating or when you've been fasting for a while when your blood glucose is low. So if you've skipped breakfast, then glucagon will be released. This is going to target the liver and adipose tissue, and what it's going to do is it'll cause them to release glucose into the bloodstream, thereby increasing blood glucose. So you can see that these two hormones act in opposition to one another, but they've both got the same basic goal, which is to keep your blood glucose levels within a certain range. So how is it that blood glucose level gets regulated? Well, let's take a look at what happens when you have high blood glucose under normal circumstances. So basically, after you eat, the pancreas will secrete insulin into the bloodstream. So this increased amount of insulin in the bloodstream will cause the liver to store glucose from the blood as glycogen. And it'll also cause muscle cells to store glycogen and build protein. But one thing that I also want to make clear is that it does cause a lot of cells, other cells around the body, to also take up glucose for their own uses. So adipose tissue is one of those other tissues. It will use glucose from the bloodstream to build fat. Now, when these tissues and other cells start to take this blood glucose out of the bloodstream, the blood glucose level will drop back down to a normal level. Now, what happens if blood glucose is low? Well, the first thing that's going to happen is that the pancreas will secrete glucagon into the bloodstream. And this increased presence of glucagon is going to cause adipose tissue to break down fat. It'll also cause the liver to break down glycogen to glucose. And in both cases, you'll get the release of glucose entering the bloodstream. So your blood glucose level will rise, and you'll be right back up to a normal blood glucose level. And so you can see that these two hormones both act in blood glucose homeostasis to keep your levels normal. So you get different responses when you get high blood glucose versus low blood glucose. So somatostatin is also known as growth hormone inhibiting hormone. It's also produced by cells in the stomach and in the small intestine. And its main effects are to inhibit the release of growth hormone by the anterior pituitary. That's the reason why it's known as somatostatin, literally keeping the body static, keeping growth static. But it will also, as I mentioned before, suppress the release of various hormones produced during digestion, including both insulin and glucagon. So other endocrine glands include the gonads, which are the testes in males, and the ovaries in females. The gonads, as well, of course, as being reproductive organs, are also endocrine glands. Other glands and certain tissues also produce hormones. Now, we'll go into more detail about what the gonads do in terms of their hormones in the reproductive system when we cover that. So the testes produce sperm and androgens, so testosterone is the main one. And this is responsible for male secondary sex characteristics, including beard growth, the enlargement of vocal cords, enlargement of the larynx. This is the reason why men have an Adam's apple and women don't. It'll also stimulate oil production by oil glands, and this is the reason why when males are undergoing puberty can also have increased acne, because these high levels of testosterone will also stimulate oil production, which leads to blocked glands and acne. Testosterone is also involved in male pattern baldness if you have the genes for that. And it's also responsible for increased muscle development, which is the reason why you have people that take anabolic steroids to try to increase the muscle development. So as I said, some athletes take supplemental amounts of illegal anabolic steroids. These include testosterones or chemicals that can cause the production of testosterone. There are a lot of unfortunate side effects from taking anabolic steroids. So acne, body odor, all this. And here's more effects that can be seen. So you'll see balding in both men and women. You'll see the production of hair on the face and chest in women who take anabolic steroids. You'll see a deepening of voice in women. You'll see breast enlargement in men and breast reduction in women. You'll also see over the long term liver dysfunction and cancer. You'll also see kidney disease and retention of fluids. This gets called steroid bloat. In men, you'll see reduced testicular size, a low sperm count, and impotency. You can also see what's called roid mania, which is delusions and hallucinations and depression upon withdrawal. You can get severe acne. You can get high blood cholesterol and atherosclerosis. So anabolic steroid use can cause heart disease. And this is one reason why you can see bodybuilders and professional wrestlers and some other professional athletes dying in their mid-40s of heart attacks. It's because that may be a sign that they've used anabolic steroids through their career, because anabolic steroid use can heighten your blood cholesterol and therefore heighten your coronary artery blockage. In women, you'll get an increased size of the ovaries, and you'll also see ovulation cease and the menstrual cycle cease. And in adolescents, it'll cause stunted growth, because despite the fact that they may be putting on muscle mass, it will cause their growth plates in their bones to prematurely turn to bone, and so they'll stop growing, so you can see stunted growth. Okay, the ovaries produce eggs, estrogen, and progesterone. What estrogen is going to do is to stimulate growth of the uterus and the vagina during development. It's also required for egg maturation, and we'll see that in more detail when we get into the reproductive system. It's also responsible for secondary sex characteristics. This includes breast development, and estrogen works with progesterone to cause breast development. It's also responsible for different patterns of fat distribution in women than in men. It's also responsible for growth of body hair. Progesterone regulates the uterine cycle along with estrogen, as I said in more detail when we cover the reproductive system. Okay, the thymus gland is at its largest and its most active during childhood. What it does is to secrete thymosins, and these hormones are involved with the maturation of T cells, which is something that we looked at when we talked about the immune system. The pineal gland produces melatonin, which is involved with sleep-wake cycles and circadian rhythms. So if somebody has problems with sleep, things like insomnia, that may be an indication that their pineal gland is not quite working correctly. So some organs, which are usually not considered endocrine glands, can secrete hormones. A great example of this is the heart, which produces natriuretic hormone, also known as natriuretic peptide, and we examined the effects of that in the last video. The stomach and small intestine also produce hormones that regulate digestive secretions. So this would be the secretions of things like gastric juice, which includes pepsin and hydrochloric acid, also secretions of other digestive enzymes. So these can be regulated by hormones that are produced by the stomach and small intestine. And there are other tissues that will also secrete hormones. Leptin is a protein hormone that's produced by adipose tissue. And what this does is to stimulate the satiety center in the hypothalamus. And what satiety is this, it's this feeling that you're full or that you've had enough to eat. And so there may be an underproduction of leptin in obese individuals, or the leptin itself may not be recognized as well by cells. And because of this ineffectiveness of leptin, then people literally have fewer signals to their satiety center, so they keep eating beyond what other individuals who have functional leptin would eat. And so this can be a cause of obesity. Growth factors will stimulate mitosis in tissues. Some of them are released in blood, and the others will act locally. So an example of a growth factor is granulocyte macrophage colony stimulating factor. This is produced by a lot of different tissues, and what this will cause is for bone marrow stem cells to produce granulocytes and macrophages, and these are the white blood cells that are involved with your immune system. Platelet-derived growth factor is involved in wound healing. So is epidermal growth factor and nerve growth factor. Prostaglandins, which we've mentioned in the prior video, are produced from a type of acid called arachidonic acid. Now these act locally, so their effects depend on where they're actually produced. They've got a lot of different effects, including muscle contraction in the uterus, the mediation of pyrogens effects. So pyrogens are chemicals that cause the body to produce fever. So basically, prostaglandins can result in the production of increased body temperature. So let's take a look at some disorders of the endocrine system. So there are endocrine glands that play a major role in regulating the development and the function of many body systems. And when these go wrong, you can see a lot of different effects happening. So an increase or decrease in production of a hormone can cause significant disease. So I've mentioned negative feedback mechanisms in terms of regulation of a lot of these hormones. If these hormones are overproduced or underproduced, then you can cause significant disease. And we're going to take a look at the effects of over and underproduction with different hormones. Cancer can often cause an increase in hormone secretion by affecting the gland. So you may have heard of something called pituitary gigantism. That's when a tumor in the pituitary gland causes an overproduction of growth hormone, and individuals reach really tall heights. Various conditions that destroy glands can result in decreased secretion of a hormone, and so these can include autoimmune conditions, which we'll talk about in just a minute. Type 1 diabetes is probably the best example of this, where the body attacks the beta cells that produce insulin, and when the body attacks these and these die, then it means that individuals can no longer produce insulin. So diabetes insipidus is a completely different type of diabetes from either type 1 or type 2 diabetes. So this happens when the posterior pituitary secretes too little ADH. And so remember that ADH is your anti-diuretic hormone. And what's going to happen here is without enough anti-diuretic hormone, you're going to have diuresis, which means urination. So individuals will have really increased urination, and they're going to have excessive thirst. And this is basically this increased urination and increased thirst is what caused these diseases to be called diabetes in the first place. So again, large amounts of urine produced, dehydration, and with an accompanying thirst. Pituitary dwarfism can occur when too little growth hormone gets secreted by the anterior pituitary. And basically what happens is that you've got individuals who have a small stature, but they've got normal proportions. So their limbs and torso will be in normal proportions. Pituitary gigantism can result from an excess of growth hormone produced during childhood. And so here you've got a picture of two individuals, one of them who had pituitary gigantism and the other who had pituitary dwarfism. And again, you can see that the ratio of their limbs to their torso is relatively normal. I think that the pituitary giant there has probably got kind of abnormally long legs. So Gigantism will also promote the development of diabetes mellitus. Now, we discussed diabetes insipidus in the previous slide. Diabetes mellitus is problems with insulin, either problems with insulin production or the problems with insulin uptake by cells. Now, these imbalances in insulin will cause high blood glucose levels. And high blood glucose levels, well, one of your body's defenses against these high blood glucose levels is to increase the amount of urination and get rid of glucose through the urinary system. So basically, diabetes mellitus, although it has nothing to do with ADH like diabetes insipidus, it has to do with insulin. Diabetes mellitus also results in excessive urination and excessive thirst. So that's what those share in common. Okay, so acromegaly is also a disorder of the pituitary gland, and in acromegaly, you get the production of excess growth hormone in adulthood. In other words, after the long bones in the arms and the legs have ossified. So there's no more potential for growth in those bones, but you'll see excess growth in the hands and the feet and the facial bones, and you can see changes in the way that somebody looks. So if you look at this individual as she grew older, the growth pattern of the facial bones, it has a pretty specific appearance. And I'm not trying to be cruel when I say this, but it looks kind of like the way that Andre the Giant looked. And so Andre the Giant definitely had acromegaly, and as a result, his facial features shifted. Cushing syndrome is an excess production of adrenocorticotropic hormone, usually by a tumor. And what's going to happen is you'll get the production of excess cortisol by the adrenal cortex. This causes protein to be metabolized and fat to be deposited in the midsection. And what you're going to see here is an individual before being treated for Cushing syndrome and after being treated for Cushing syndrome. So when people say that obesity can be glandular, we've seen how leptin can cause obesity, and here you can see how Cushing syndrome can also be glandular and also cause obesity. Okay, next we're going to discuss disorders of the thyroid, the parathyroid, and the adrenal glands. So hypothyroidism is when you don't have enough thyroid hormone produced. This can be a result of failure of thyroid function in infancy or in childhood. This is something that's called congenital hypothyroidism. So individuals who have this happen can be short and stocky. Mental retardation can occur if treatment doesn't begin within the first 2 months of life. It can be complicated to address hypothyroidism because people respond differently to different brands of artificial thyroid hormone, and they respond to different levels. So people who have to take medication for hypothyroidism have to do this under the care of an endocrinologist, because you've really got to tinker with the medications and the medication levels to get normal results. So again, treatment is going to consist of the administration of thyroid hormones. So this is what you can see with congenital hypothyroidism, and in hyperthyroidism, you can see both a simple goiter, which affects, which you can see in the neck, and an exophthalmic goiter, which can cause protrusion of the eyeballs. So Hashimoto thyroiditis is a form of hypothyroidism, so we're back to a deficiency of thyroid hormones that occurs in adults. And this happens when the immune system produces antibodies that destroy the thyroid gland or destroy a lot of the cells that actually produce the thyroid hormones. And as a result, you'll get a group of clinical symptoms called myxedema in adults that are not treated for Hashimoto's. These symptoms can include weight gain, hair loss, constipation, and slow heart rate. And again, these individuals have to take synthetic thyroid hormones under the care of an endocrinologist. Goiter is caused by a lack of dietary iodine, and what happens here is that the thyroid can't produce sufficient T3 and T4. Now what happens is your central nervous system detects that there's not enough T3 and T4 in your bloodstream, and so the hypothalamus will signal the anterior pituitary. The anterior pituitary will signal the thyroid, and it'll continually be sending these stimulatory hormones to the thyroid. But the thyroid can't produce T3 and T4 without iodine, and as a result, it'll actually grow or enlarge, and this is where you can get simple goiter from. Hyperthyroidism occurs when you have an oversecretion of thyroid hormones. Graves' disease can result from antibodies that react with thyroid stimulating hormone receptor, and basically what these antibodies do is mimic the effect of TSH, so it's as if you're producing a ton of thyroid stimulating hormone, which results in the thyroid producing a lot of T3 and T4. And so your symptoms can be protruding eyes, nervousness, hyperactivity, and what's really dangerous is abnormal heart rhythms. So let's talk about a disorder of the parathyroid. Most of the time this involves insufficient parathyroid production. And when that happens, then you're not stimulating the intestine to take up calcium. You're not stimulating the kidneys to reabsorb calcium. You're not stimulating the bones to release calcium. And so you're going to have drops in blood calcium levels, and you can get continuous muscle contraction or basically shakes from tetany, and you can also have nervous system dysfunctions, including dysfunctions in brain function, and you can also get dysfunction in your heartbeat. You can have irregular heartbeats, or you can have heart attacks that eventually result from this. Disorders of the adrenal glands include Addison disease, and Addison's disease results from destruction of the adrenal cortex by the immune system. So symptoms include weakness, weight loss, abdominal pain, and as you can see here, bronzing of the skin. So now we've seen a couple of different diseases that result from the immune system attacking your own body cells. So we've seen Addison's disease, and we saw Hashimoto's before that. And as I mentioned, type 1 diabetes is also caused by the immune system attacking the cells that produce insulin. So autoimmune disorders can result in dysfunctions of the endocrine system. Also, another symptom of Addison's disease is sodium and potassium levels being altered in the bloodstream. And again, this can adversely affect the heart. Basically, too much sodium can cause a heart attack. Now, diabetes mellitus, this is both type 1 and type 2 diabetes. So again, I want you to recall that diabetes insipidus results in defects, is a result of defects of ADH production. Diabetes mellitus is problems with insulin. And so diabetes mellitus affects about 8.3% of the population as of 2010. And your ability to regulate blood glucose levels is what diabetes mellitus is. Now, type 1 sufferers don't produce enough insulin, and type 2 sufferers produce normal levels of insulin, but their cells don't respond to the insulin. So basically, as blood glucose rises, then the body reacts to levels, rising blood glucose levels by trying to get rid of this glucose through the urine. And so this is when glucose shows up in the urine, and this is something that, as we mentioned, in the urinary system should not happen. So in type 2 sufferers, cells don't take up the glucose that's produced. So type 1 diabetes is usually, it can be called juvenile onset diabetes because it's in kids and in adolescents where that autoimmune disease actually attacks the beta cells of the pancreas. Type 2 is often called adult onset diabetes because this is something that usually happens in middle age. So in both cases, you're going to have increased thirst and increased hunger, either from type 1 or type 2 diabetes. And so again, the point of commonality between diabetes mellitus and diabetes insipidus is increased urination and increased thirst. So a glucose tolerance test often gets used for diagnosis as to whether you have type 1 or type 2 diabetes. So here is a graph that's going to show you a glucose tolerance test. So what is it that happens in a non-diabetic after receiving glucose? You're going to see a spike in blood glucose levels, but it's going to drop back down to normal levels within an hour or so. With a diabetic, you don't ever get back down to normal blood glucose levels, which are between 75 and 100. And so basically, what do you do here? You administer glucose and you check and see, first of all, how high does this blood glucose level spike and what does it decrease to, if it decreases at all. Okay, so again, two types of diabetes mellitus. One is called insulin dependent. It can be an autoimmune condition that causes this. It can also be caused by a virus. So as cells break down fats for energy, you have a buildup of ketones in the bloodstream. And ketoacidosis is going to cause coma and death. And so I know that right now there are a lot of people that do diets that talk about building up ketosis. But if you build up too much of this, then you can go into a coma and death can ensue. But the thing is, most people actually have a very hard time reaching this level if they're not diabetic. So if you overdose on insulin, then it can cause hypoglycemia and unconsciousness. And if that happens, then you've got to take in some sort of glucose source to counteract the insulin. So with diabetics, sometimes at least in my experience as a type 2 diabetic, the intensity of the diabetes can fluctuate. And some of it, I think, depends on physical activity level, and I think some of it depends on fat mass versus lean mass. And so you can become more or less responsive to the insulin that's already present in your bloodstream. And what this can mean is a lot of the time, if type 2 diabetics begin to exercise a lot, then they can take levels of insulin that worked for them in the past but are actually too much, and then you can get these symptoms of an insulin overdose. And in my experience, hands and feet get really cold and I see white flashes before my eyes. I get heart arrhythmias. Basically, the heart will speed up and become a little bit erratic, and it is a certain sort of set of sensations that are associated with that. So if I've overdone it with insulin, I usually know within about 45 minutes to an hour. Okay, so again, type 2, which is what I have, is this insulin resistant, and it can be linked to obesity. And I think I've told you all that I used to weigh over 300 pounds for quite some time, and so it is linked to obesity. Insulin levels are often low, and cells may not have sufficient insulin receptors. So this can be controlled sometimes if you're lucky by diet and exercise, and if you're not so lucky, then by medications. And so there can be oral medications that can increase the ability of your body to utilize the glucose that you take. One of the most common ones of these is metformin. And so for some people, the oral medications don't work and they'll just take insulin. I don't mind giving myself shots, so insulin works just fine for me. So I do find that when I'm working out regularly, that my need for insulin does actually decrease. So diabetics have to monitor their blood sugar several times daily, regardless of whether they've got type 1 or type 2. And it's usually done with a finger stick, and then you test it using some sort of blood glucose monitor. Nowadays, there are new testing devices being introduced, and these testing devices will actually monitor your blood glucose level and actively inject insulin. And so basically, this is almost like an artificial pancreas that replaces needles and syringes as an injection method. And so you can see that um, basically you'll put this pump on the surface of the skin, and at that point it can monitor your blood glucose levels. And there are some devices out now where you can check your blood glucose levels with an app on your phone, which is pretty cool. So the long-term diabetes complications can be blindness, kidney disease, cardiovascular disorders, and this can lead to reduced blood flow to limbs, which can cause gangrene. And gangrene is when tissues die off from lack of blood supply. And in fact, type 2 diabetes is actually the leading cause of amputation in the United States. You can have diabetic comas in pregnancy with if gestational diabetes occurs. And if you have gestational diabetes, then the child, or type 1 or type 2 diabetes, the child can have a higher risk of being either stillborn or dying shortly after birth.